Alright, here's another example. I'll get you to pause the recording and I'll go through it. Okay, this is an example of long QT syndrome, and it might surprise you, but the ECG features to look out for are prolonged QT intervals. So it's a disorder of myocardial repolarization. Symptoms include palpitations, syncope, seizures, and sudden cardiac death. And the ECG will obviously show a prolonged QT interval. Now remember, the QT interval will vary with heart rate, and there are different formulas to correct for the heart rate, but essentially the corrected QT interval, the QTC, of greater than 440 in men or 460 in women, that's considered prolonged. And if you have a prolonged QT interval, well, that predisposes you to Torsades VT, okay, and syncope. Long QT syndrome might be congenital and it might be acquired. Congenital long QT syndrome is a channelopathy, so a defect in an ion channel leading to long QT syndrome, but there are many causes of acquired long QT syndrome. Some of the most common causes are drugs, and we've got a list here. It's obviously going to be pretty difficult to memorize a list like this, but there are some helpful websites out there such as Credible Meds, and you can essentially just type in the medication you're concerned about and it'll tell you the risk of long QT with that drug. And so the issue with long QT syndrome is that it can predispose you to this R on T phenomenon. So that's what we've got here. We've got a long QT interval, and then in the middle of this QT interval here, in the middle of the T wave more like, we've got an ectopic beat. So this R wave has landed on top of the preceding T wave. So the ventricles have started to depolarize, okay, R wave, while other parts of the ventricles are still in the middle of repolarizing. And that sends the patient into this polymorphic VT, or into Torsades. And then, they have syncope, and then cardiac arrest, and it's a medical emergency. And that's really the risk with long QT syndrome.